to the Doctors In on CNN Philippines. I'm Dr. Freddie Gomez. This program is for you, our viewers, so that we may answer your medical questions and concerns while the COVID-19 pandemic is still upon us. COVID-19 continues to evolve, so it's normal to feel worried, especially if we discover any unusual symptoms, including unusual growths or unusual lumps. To talk more about this, we have on the program Dr. Richard Cedeño. He's the chairman of the ENT-head Department of Makati Medical Center, fellow of the Philippine Society of Otolaryngology, Head and Neck Surgery, and a member of the Academy for Head and Neck Oncology of the Philippines. Very impressive qualifications. Thank you for being with us on the show, Dr. Cedeño.
Yes, good afternoon. Thank you for inviting me here, Dr. Freddie.
Now, Dr. King, we can have lumps in any part of our body, but today we'll focus particularly on the head and neck region. So, doctor, how common is it that something unusual is found in someone's head and neck area? Something like a lump in the neck, or maybe a wound that doesn't quite heal properly in the nose or in the mouth?
Well, in my practice, there are a lot of patients who come to me with lots of, they complain of lumps or non-healing wounds, but most especially in the oral cavity area. I mean, the non-healing wounds, but tumors, I usually see them on the neck or the face, and it's always a cause for concern.
That's right. So whenever you talk about something like this on someone's body na hindi sila sanay, something unusual, it's important to talk about possible risk factors that may contribute to any unusual growth in the head and neck area. Can you mention some of the risk factors that may contribute to these unusual growths?
Okay, risk factors. Well, the most common is cigarette smoking or tobacco use. Actually, 85% of head and neck cancers are linked to tobacco use or cigarette smoking. Even if it's second-hand smoking, yung paninigarilyo ng ibang tao, din nalalanghap ng mga taong nakapaligid na hindi naninigarilyo, it also increases the risk of head and neck cancer. Another is frequent and heavy alcohol consumption, yung mga malakas uminom, that can also develop cancers in the mouth, in the throat area, even sa voice. Marami pang pwedeng risk factors like, well, prolonged skin exposure, yung balat natin, pwede magkaroon ng mga skin cancer pag matagal na nasa araw. Some men are more prone actually than women. Men are 2 to 3 times more likely than women to develop head and neck cancers. Another is age. Patients above 40 years old has a higher risk also of developing head and neck cancers. Poor oral hygiene, hindi nagsisipilyo, hindi naglilinis ng bibig after eating, yan. That also increases the risk of head and neck cancers. Would you believe even marijuana use can also pose a risk for developing cancer? Another is poor nutrition. So dapat marusog ang pagkain natin. We should balance our diet and eat fruits, veggies, dapat balance talaga. Even stress can cause cancer because it causes hyperacidity, and hyperacidity has been linked also to the development of cancer.
Right.
These are just some of the risks.
Yes, doctor. So marami talaga factors ang pwedeng cause. Pero madalas, hindi natin maiiwasan na matakot kapag may nakakaibang bukol sa ating katawan. Normal lang po na maging concerned po tayo dito. But it's also important to know what we should do. So my question for you, Dr. King, is are there any warning signs that people should watch out for?
Yeah, it's always an abnormality kapag may bukol na tumubo sa katawan. So the earlier the better. Na pag may bukol pa lang na napuna, dapat mapacheck ka agad ito sa doktor. Even though if it looks benign, even something that looks mukha siyang hindi cancerous, later on pwede rin maging cancer. So isa ng bukol, basta may tumubo sa leeg o sa muka or sa ulo, dapat ma-check ka agad ito. Sometimes yung hirap na paghinga, nasal obstruction, yun pala may bukol na rin sa loob ng ilong. There are those na pamamaos. Yeah, pag kumanta na mamaos, diba? We get hoarse, but if the hoarseness is prolonged, like already 2 weeks, 3 weeks, you have to have it checked because there might be a mass inside the throat. Baka may bukol na doon. Especially if the person is a smoker. Mga non-healing wounds sa bibig. Minsan may singaw. Yeah, normal na may singaw, pwedeng mawala ka agad. Pero pag nagtatagal na, more than a week, 2 weeks, lalo na 3 weeks, dapat mapacheck na kaagad yan. Kasi non-healing wound sa mouth, usually it's already a suspect for cancer. So those are concerns. So even pain, may bukol ka tapos painful, dapat ma-check ito. Persistent na sore throat, yung pagduduling ng mata, that's also a concern kasi baka may bukol na sa likod ng ilong. Maraming pwedeng signs for having a tumor or a cancer. So basta something that is not normal, dapat mapacheck ka agad ito.
That's right. Marami talagang factors ang pwede dito. Kaya mas maganda is huwag magbakasakali na lang. Kung meron nakapa ating mga viewers na bukol, pa-check na sa doktor agad-agad para sigurado. Now let's take some social media questions from our viewers. We have a question here from Edwin. Ang tanong ni Edwin, kapag na-diagnose ka ng ENT doctor na merong nasal polyps, cancer na ba yon? What do you think, Dr. Cedeño?
Okay. Nasal polyps are really common. They usually appear because of allergies. Yung madalas na pagsisipon, bahing ng bahing yung pasyente. Yan, nagkakaroon ng polyp if the allergies is not controlled. Commonly, pwedeng mawala yung sneezing or yung pagsisipon, tapos ang mangyayari, barado na lang ilong. If there is nasal obstruction, it can only be nasal polyp. However, commonly, if one-sided lang yung nasal polyp, that's more of a concern kasi pwede siyang tinatawag na inverted papilloma, which is a precancerous tumor. Pwede itong maging cancer. So, even though na common yung mga nasal polyps in allergy patients, we still have to check yung bukol na nasa loob ng ilong and to determine if it's cancerous nga or hindi. We may assume na benign, pero pag inopera ng pasyente na may nasal polyp, dinadala pa rin namin to sa laboratory for biopsy para ma-check kung is it really a benign nasal polyp lang or probably cancerous na pala. It can happen sometimes. It happened to me in one of my patients na it just looks like a polyp, mukha siyang benign, pero nung tinanggal na namin at nung lumabas yung biopsy, cancer na pala. So kailangan pang balikan yung pasyente for another surgery.
Okay, so it's very That's right. So very important to be comprehensive as well with the diagnosis on that. And so we have to pause for a quick break, but we will continue to discuss with Dr. Cedeño things and questions that you may have, which is very important, especially what to ask your doctor when you have an unusual bump or sign that may be something serious. All this and more when the doctor is in return. Welcome back to The Doctor is In. I'm Dr. Freddie Gomez, and you're watching CNN Philippines. Most Filipinos avoid going to the doctor even when they're feeling pain or discomfort. And this is for fear of being diagnosed of something more serious like cancer. That is why it is important to talk to your doctor and ask the right questions. To help us get the right answers, we are still with Dr. Richard Cedeño, an ENT head and neck surgeon. Now, doctor, many are fearful when they hear the C word or cancer. And this fear may be what delays them from getting the right treatment. What should be the mindset of someone when faced with the possibility of malignancy?
Well, it's always difficult for a doctor to break the news to a patient that they have the big C or cancer. So we try to be um, as sympathetic as possible when dealing with patients with cancer, especially when the biopsy comes out. We we already primed them before doing the biopsy. And the possibility of getting cancer is there, but we try to assure them also that we will do everything to treat this condition. So let's say when it comes out, sometimes we assess the patient, mahina ba ang loob ng pasyenteng ito? If mukhang mahina, we call the relatives to be there para when we explain, mas maintindihan. So when dealing with this, we just tell them that, let's say, you have cancer na like this, but it is treatable with this one. So we give them also the options. It's important that they understand the type of cancer they have. Marami kasing klase ng cancer, iba-iba yan eh. And then staging is also different. So with the different kinds of cancer comes different kinds of treatment, and what best way to manage this is calling for a multidisciplinary meeting also. You get the help of a radio oncologist or a medical oncologist if needed. Kung may involvement sa lungs, you call also a pulmonologist. So maganda, nagkakaroon ng meeting ng doctors. We talk about the case and we come up with a good management. Then once we come up with a good plan, we call the patient in and then we explain the condition of the patient, yung options niya, paano magagawa yung treatment and everything. And we also tell the patient to ask any questions dun sa group of doctors with him during the meeting para they can have a clear idea. And that will also include not only the treatment, but the side effects, the cost, and the future concerns. Kasama yon.
Right. So a lot of things have to come into play. So many things are factored in, and knowledge and knowing the enemy can be a powerful tool in taking away some of that fear that a patient may have. But one question that should be in every person's mind, in every patient's mind, is what are the treatment options available? Just like what you touched on a little bit a while ago, Dr. Cedeño. So how does our treatment options here in the Philippines compared to that of other countries such as Singapore or even the United States?
Actually, we are at par with other countries. So we can do our treatment also here. Uh, Only if there are managements that are not available, like proton radiation is not available here. It's available in Japan. I think they have 2 or 3 proton radiation centers there, and it's really expensive. Other countries only has one, and right now we don't have it here. But seldom we use this kind of technology. So most of the cancers we can treat it here. We have nasopharyngeal cancer, cancer at the back of the nose. We treat that well centuries ago, like 10 maybe or 20 years ago. Uh, it's hard to treat nasopharyngeal cancer, but right now most of my patients they survive and they go back to work. Other cancers like the thyroid
Okay.
cancer, like papillary thyroid cancer, that's easy to treat. So that's what a cancer that we call like a friendly cancer. So most patients really survive. Actually, I haven't seen a patient not surviving papillary thyroid cancer. Dapat mas-set ang mind ng
Okay. Yeah,
patient
that's good to know
na
actually.
yeah, there's always a possibility na magamot and mawala talaga yung cancer than worrying what will happen and paano yung treatment, paano yung side effects, something that they still don't know. But later on, pag nagawa naman, gagaling naman din pala sila, worry won't be able to help eh. They don't know what's going on. Better they talk to a doctor or a specialist para
Right.
ma-explain lahat ng maigi.
Okay. Okay, so now it's time to take a look at some of the social media questions. Marami po tayong mga tanong coming in from the CNN Philippines Facebook page. We have one from Eman. Ang tanong naman ni Eman, is surgery the best option for head and neck cancers?
Well, not all head and neck cancers need surgery. Most of them need surgery, yes. But let's say if you're talking about lymphoma, it's not a surgical, it's not managed surgically. It's managed by chemotherapy. And chemotherapy treatment for lymphoma is very good in our setting in the Philippines. Most of the cancers
Okay.
are surgically removed, but it also depends on the stage. Kasi the earlier we get the staging of the cancer, let's say stage 1 or stage 2, sometimes stage 3, na ooperahan pa. Pero kapag napabayaan kasi, hindi na natakot, hindi
Okay, so
nagpa-check
time is
at kumalat na sa ibang parts ng katawan, you cannot do surgery on that anymore.
So the earlier we see it, the better we can treat it. Very good, very good option for that. We have another question from Michelle, Doctor. Ang tanong niya is, paano yung mga hindi maka-afford? Meron bang paraan na makakuha kami ng parehong quality of care? So for those who cannot afford the treatment for head and neck cancer, is there an option for them to still get the right quality of care?
Yes, they do. They do. They have to be honest with the doctor, even with the expenses or financial problems that they have. They have to explain to the doctor yung situation nila. Sometimes these patients don't speak up or nahihiyang magtanong. So at times, I am the one who asks them, kakayanin niyo po ba? O kung hindi po kasi, we have charity. We can do charity cases here, and we will still use the best option. Matutulungan namin kayo. So best na ako, when I explain to the patient, sabihin nyo lang po kung hindi kaya para matulungan din namin kayo. You're not alone in this. Your problem na cancer that you have, problema ko rin po yon. So problema ko yung gamutin kayo ng maayos. So we have to give that assurance. So
Okay.
let's say in my practice, I practice in Makati Med. There are patients who will not be able to afford the treatment, but I refer them for charity, and they get the same amount of treatment, the right kind of treatment. And we try to help them also with the expenses kasi meron namang
Very good.
foundation na pwedeng tumulong.
Right. Now, before I let you go, Dr. Cedeño, do you have a very brief message for our viewers who may still be unsure whether or not to have that unusual growth that they may have checked?
Okay, siguro what I can say for these patients, worry cannot help. Seek help with a doctor, with a specialist, so that we can explain properly yung condition, malaman ninyo yung options. If you still just wonder kasi in your mind kung ano nangyayari and you go to Dr. Google, you'll just see it will just create panic sa emotions ninyo if you just search over the internet. Better you go to the doctor so that the doctor can explain your condition properly nang malaman nyo yung options nyo. And the earlier na ma-check ang bukol or abnormality na nararamdaman, the better para mas maagang magamot ang condition na ito.
Maraming salamat, Dr. Richard Cedeño, for joining us and sharing your expertise to our viewers. May the Lord continue to guide your hands in helping your patients. We'll take a quick break, but when we return, we'll talk about continued care for cancer patients during this pandemic. Stay with us right here on CNN Philippines. You're watching The Doctors In on CNN Philippines, and we're very glad you could join us. Dr. Freddie Gomez. The pandemic poses a bigger challenge on patients seeking medical care outside of COVID-19. Kasama na rin dito ang mga pasyente na na-diagnose with cancer. So let's talk about continued cancer care in this time of COVID-19. Joining us now is Dr. Gerardo Cornelio. He is an oncologist and the director of the Cancer Institute at St. Luke's Medical Center, Global City. Welcome to the show, Doctor.
Good afternoon, everyone. Dr. Freddie Gomez. It's an honor to be here and to be invited. to speak on this topic.
And we're glad to have you. Now, doctor, aside from the limited mobility during this time, what other challenges are being faced by cancer patients, especially those on active treatment?
Right now, of course, after the lockdown, we've started trying to get back to the usual practice that we've been doing. But the big challenge was during the lockdown in March. I think we had logistical problems for the patients, no? Nahirapan po silang pumunta sa hospitals, plus psychosocial factors, the fear and the anxiety of going to the hospital because of the COVID cases that we had. Now, what we did was we we made sure that these patients are taken care of. We assured them, and we went into group practice in many centers to provide care, continuous care to most of our patients during this time.
Okay, napag-usapan naman natin yung mga different protocols ng iba't ibang hospitals. We know that cancer patients are considered immunocompromised. So how should hospitals respond to cancer patients during this pandemic?
We actually separate our treatment facility from where the COVID cases are. And of course, we ensure that most of these patients are well taken care of. And number one, we offer what we call health declaration forms that these patients have to fill up, and of course make sure that our staff and the workplace is also secured for our patients. Now, there are actually papers that have come out this June that have been published that patients with cancer did not really do badly with COVID, and even those with on chemotherapy or treatment did show patients doing well with even with the COVID. So I think this should allay the fears of many of our patients coming in for treatment.
That's good. That's good to know. And simula nung pandemic, telemedicine is one of the most effective platforms in addressing medical. But in the case for cancer patients, pwede rin applicable din ba ang telemedicine sa mga cancer patients?
Yes. Actually, what we did was we prioritized our cancer patients. No, those patients who really need immediate care are seen face to face. But of course, they are advised to wear face mask, hand hygiene, and face shields when they come to the clinics. Now, those patients who are on follow-up or are on hormonal treatment, for example, or oral therapies, they are now advised to do telemedicine. So this is what we do now for many of our patients, cancer patients, to avoid exposure and, of course, transmission of diseases.
Excuse me. Now let's answer some of the social media questions that we have online. We have a question from Maricel. Are there any added costs to cancer treatments during this pandemic?
Not for oncology. I think the treatment still is the same for all hospitals and for all our patients. And of course, the fees are basically the same.
Okay, so that's good to know as well, ano? So walang ma-added costs doon. May tanong din si Susan, ang sabi niya, how else can we help cancer patients cope emotionally, mentally, and physically, especially during this time?
The doctors actually, as oncologists, already tried to do this for our patients, try to assure them. But we do work with psychologists as well, including, of course, our team, to help out our patients who are feeling anxious during these times. These are crazy times, but of course we try our best to really assure our patients that they need to be cared for, just the same way as we do for other patients.
Thank you very much, Dr. Cornelio, for sharing all of these important insights on cancer care, especially during these difficult times.
I would also like to share with you what
And
hospitals or centers are doing. No, right now they are offering home service for laboratory tests for many of our patients, so that patients can just do the test at home, and then we can do telemedicine or teleconsults for them. And of course, for those patients who need immediate care, they are segregated, and we see them in face-to-face clinics.
thank you very much for that information, Dr. Cornelio, and thank you all again for joining us today. So patuloy pa rin ang pagtaas ng COVID-19 cases, so in order to prevent the spread of infection, we need to follow important health precautions. Social distancing, proper hand washing, and wearing of face masks should always be followed. So we will talk more about COVID-19 in the country tomorrow at 3:30 p.m. I'm Dr. Freddie Gomez. Stay safe, everyone.